Hello, my name is Ashley Libretti, and I'm here to present to you my capstone project for my MSN with a concentration in executive leadership at Benedictine University. The title of my project is the Progressive Mobility Recovery Program in the Acute Adult Medical Unit. The purpose of my project was to create and implement a timeline and future evidence-based, patient-centered progressive mobility recovery program in the acute adult medical unit intended to result in increased patients' mobility and satisfaction, decreased length of stay, and improved patient health outcomes. I'm going to give you a little background on my capstone project. When starting the project, I identified a deficiency in the progressive mobility recovery programs within the acute medical setting. A progressive mobility recovery program is a standardized tool for healthcare providers and patients that can help monitor the progression of mobility and set activity goals in which patients can attain. A progressive mobility program works towards range of motion exercises, longer sitting times in a chair, and longer walking times for the patient. Currently, there's no standardized tool or program in any of the acute medical units at my healthcare organization, which has led to a lack of motivation to mobilize patients regularly. This in turn can result in a functional decline in patients, which can in turn result into longer lengths of stay, avoidable nursing home placements, decreased mobility, adverse health outcomes such as pressure-related injuries, hospital-acquired pneumonia, blood clots, and even an increase in mortality rates. A study done in 2016 by King, Stieg, Windsor, Vindenberg, and Brown had shown that up to 65% of older adults lose their ability to ambulate on their own during a hospital stay. Implementing a progressive mobility recovery program will help counteract this and also provide patients independence during their hospitalization and establish accountability of the patient and healthcare providers of patient mobility. Progressive mobility programs have a very large positive potential impact at a very relatively low cost margin. A literature review of research was completed for this project on supporting the importance of a progressive mobility program and adverse outcomes it can prevent. The search was conducted using the Cumulative Index of Nursing and Allied Health Literature, or the CINAHL database, and Google Scholar. I used the focus words of mobility, medical unit, hospital inpatient, mobility program, patient safety, and functional decline. The search was then narrowed down to peer-reviewed research studies conducted between the years of 2014 and 2019. Many of the earlier studies involved early mobilization and the intensive care unit setting, but just trying to focus on the medical unit and mobility in the hospital setting. Some of the common themes found were overcoming barriers to mobilizing patients and how progressive mobility has helped positive health outcomes for the patient. The conceptual framework of this program is a progressive mobility framework in which clear guidelines and assessment parameters will be determined to develop the program. Progressive mobility programs are a slow-moving process in which patients continually progress their activities such as range of motion exercises, sitting times, and walking times. The progressive mobility framework has a set of standards of practice, which include receiving activity orders from the physician, assessing a patient's mobility, and following the exclusion process if the patient meets any of those requirements. The SWOT analysis for this project has many strengths in which we've covered, such as cost efficiency, decreased length of stay, and positive health outcomes. The willingness and motivation of staff and patients is a barrier to the project, which we will have to adapt to. The sustainability of the project is always in question as well. Utilizing our opportunities, though, like developing mobility teams comprised of mobility champions, will be essential to the process and its success. Also partnering with safe patient handling to ensure that patients and staff members are always mobilizing safely is definitely key. The threats to the project could be substantial and will take some support from leadership to help break down some of those threats. Inevitably, a change of culture of mobility will have to take place in order for the progressive mobility program to sustain over time. The setting for this project is Advocate Christ Medical Center. The medical center is a level 1 trauma center in the south side of Chicago. The unit specifically being utilized for the project is 7 South. It's a 44-bed medical unit. The patient's population will include patients from the ages of 18 to 100 plus. They'll include medical conditions such as chronically vented or tracheostomy patients, peritoneal dialysis patients, chest tubes and drains, post-procedural, and a vast array of other medical conditions and treatments. The project objective is to establish a successful and sustainable progressive mobility program in which patients and healthcare providers can easily follow and attain the mobility goals that are set before them. The proposed evidence-based change includes a progressive mobility log seen on the slide that will be hung in every patient's room. On that log, the patient will be identified as a specific mobility level. The mobilities levels range from 0 to 4 based on their activity. A level 0 is complete bed rest, and a level 4 is ambulating without any assistance. Based on the level of the patient, they will have a set of activities they will work towards attaining. The goal is to move up the level of mobility to reach a level 4 or reach their personal activity baseline. The proposed intervention will include a daily assessment of patients of their mobility and interventions. This will be a multidisciplinary approach between physicians, nursing, patient care techs, care management, and rehab. The progressive mobility log will be patient-centered and driven, and will also be a collaboration, between safe patient handling and utilizing the safe patient handling equipment will be a requirement for all staff. The evidence-based program is important to the healthcare organization because early mobility programs have been initiated in many of the intensive care units at Advocate Christ Medical Center. However, there isn't a progressive mobility program for the inpatient units. The importance of continuing the progress of mobility that the patient has made in the intensive care unit is paramount. Also, the patients who aren't in the intensive care units need a program that will keep them mobilized and avoid any adverse outcomes or deconditioning. Advocate Christ Medical Center is a level 1 trauma center, so the patients have extremely high acuities, and it makes it even more important that their mobility is the forefront of their recovery. The key stakeholders involved in this evidence-based program will be nursing leadership on the unit, nursing, patient care technicians, physicians, safe patient handling managers, care management, and rehabilitation therapists. The group of individuals will work as a collaborative team to encourage and follow through on the patient's mobility plan. Nursing leadership will play a vital role in holding the staff accountable and following the progressive mobility program. The Chief Nurse Executive, Chief Operational Officer, Director of Medical Surgical Services, Safe Patient Handling Manager, and the Unit Manager are also key stakeholders in support of the project and can provide good insight and resources when needed. Overall, the support and reception of the project so far has been extremely positive. The budget for this proposed evidence-based project would be relatively low to start. The costs could increase over time as equipment becomes worn and needs to be replaced, or as more staff is needed to fill in for the demand of mobility. Also, if there is a mobility program, if it were to be expanded to other units within the hospital, training costs would increase the budget over time. The medical center where the proposed change is going to be implemented has received new safe patient handling equipment and training to all staff in the last 2 years. This has had a major impact on the overall budget, as those costs would be exponentially larger if that training had to take place or those equipment needed to be bought. The costs that would be associated with the proposed change would be training sessions for staff on the progressive mobility program, printing services for the interactive progressive mobility tool, education brochures for patients, and additional staff members for the first week of the project when it's implemented to be available on the units. The total cost at this time for the project will be approximately $7,200, but that's a rough estimate. There is no immediate indirect costs seen at the time, but indirect costs are likely to arise while the project is being implemented. Data collection will be done daily, weekly, and monthly. Every day, patients will be assessed for their mobility level, and that will be collected on the daily mobility tracking tool. This information will then get compiled onto a percentage mobility tracking tool, which kind of will provide an overall view for the month and how many patients are meeting their activity goals and progressing to their activity goals. Length of stay will be determined by a guided performance scorecard, which is unique to the advocate system and gives a daily representation of length of stay and patient satisfaction. Patient satisfaction will also be measured by the Cipher patient rounding tool. This rounding tool is utilized by research every day to assess patients' overall satisfaction and well-being. The future of this project will continue to be carried out by myself. However, the mobility team will help aid in moving things forward. The future of the Progressive Mobility Recovery Program is very positive, and while there is a lot of work that still needs to be done, a strong platform has been established in the hopes that the program will continue to grow over time and create a culture of mobilization. As far as moving the project forward, establishment and training of the mobility team will continue through August. In September, the plan is to roll out education to the staff, and then we have a go live date of October 1st. As far as this project, it has helped me grow so much as a nurse leader professionally and personally. I have been able to network within my healthcare organization, and I've had opportunities that I would have never experienced if it weren't for the project. I'm truly grateful to better understand all the other disciplines throughout the medical center and have a true appreciation for their job and what that entails. I've developed such a passion for patient mobility and all the benefits it has to offer to patients and their health outcomes. I want to continue to spread the word on how important mobility is for patients and how it directly affects everything they do and their recovery as patients in the hospital. At times, the project could be daunting or challenging, but overall, I've had a great reception from many of the key stakeholders and have felt complete support from my executive team as I've embarked on this journey. I've been very grateful for the support from my preceptor, and I've learned so much from her during this process, and she's opened up so many opportunities for me to enhance my leadership skills. The process has been so positive and enlightening and has not only made me a better nurse and leader, but a better person. I can't wait to share my knowledge and continue my career in nursing leadership. Thank you.